Two people were shot dead in the central Kenyan town of Nanyuki amid protests against U.S. plans to establish an Ebola isolation center at a military base nearby. The U.S. plans to establish an Ebola treatment facility in Kenya has sparked public concern about cross-border infection risks. Speaking for the first time about the issue, President William Ruto defended the plan, saying that Kenya had deployed every arsenal to protect the country.
Eyewitness video showed protesters on June 1st gathering on a street in Nanyuki near the Laikipia airbase. Where the United States is planning to establish a center for American Ebola patients. Demonstrators took to the street in response to U.S. plans to set up a facility at the base for American citizens exposed to the Ebola virus.
We want to tell the president he cannot be making such a decision to people of Kenya without even considering what will be the effect of what they are doing. We feel that we are being shortchanged because they didn't even come for public participation. Everything that affects the people should come for public participation. So we, the people who are surrounding this area, and specifically Laikipians, we reject with the strongest terms the building of quarantine facility in Laikipia County.
The plan to bring in Americans exposed to the outbreak in the Eastern Democratic Republic of Congo and Uganda has drawn sharp opposition among many Kenyans since it came to light earlier last week. Kenya's government provided written approval for the plan, but has not directly addressed it in public comments. In an order, Kenyan High Court Judge Patricia Nyaundi barred the government from admitting anyone exposed or infected by Ebola under the planned agreement until a challenge brought by the Katiba Institute Legal Advocacy Group was resolved.
I'm really happy that the court has halted. I'm really hoping that they will halt it completely, they will stop it completely, because they are putting our lives at risk. Because Ebola, well, if there's an outbreak of Ebola, then that's going to be a huge pandemic for Kenyans. So we reject the Americans from setting up facilities here in Kenya.
Today, we are told there's an Ebola quarantine facility being built in Nanyuki for white people, only for Americans. Who makes these decisions? Who does this government represent? Who does this government represent? Today is Madaraka Day. And today here the military is protecting an American white people quarantine facility in a country that we don't even have any Ebola. We do not have any history of Ebola here. Why are they not doing it in the DRC? Why are they not doing it in Uganda? Why must they bring it here? So we are saying we categorically, no negotiations, no public participation, we want nothing. We want that facility taken out of our town. We want it taken out of Kenya.
U.S. officials said that the United States was planning to send Americans exposed to Ebola while abroad to a new facility in Kenya instead of flying them home. The officials spoke on condition of anonymity to discuss the administration's plans. They said the facility would be at Laikipia Air Base and would be operational with 50 quarantine beds. Kenya's Health Minister, Aden Duale, said the quarantine center was for everyone and not exclusively for U.S. nationals. The U.S. government intends to commit $13.5 million towards Kenya's Ebola preparedness efforts, Secretary of State Marco Rubio said in a statement.
They have deployed huge resources. They've given us a grant of close to 200 billion Kenyan shillings to support the building of our health infrastructure. They've done it before. It's not the first time. Why anybody would want to politicize, to mobilize negative politics on a matter so serious as a pandemic. You know, we are a responsible government. We know what we are doing. So people should relax.
Local leaders, including Laikipia Governor Joshua Irungu, has told journalists that they were opposed to the establishment of an Ebola quarantine center. Kenya has not recorded Ebola cases, but neighboring Uganda has reported 9 and closed its border with DR Congo. At least 282 confirmed cases have been reported in the DR Congo, with over 1,000 suspected cases of the Bundibuyo virus, the current species of Ebola, which has no approved treatment or vaccine. Africa Bureau, WION. World is One.